Welcome to Adapting Class. Short video regarding valvular heart disease, but contain high yield information to teach you everything you need to know about this concept, mnemonics, simple way to remember them, and use them to answer any question. This is the video you want to watch. Let's get to it. First thing, your heart has 4 valves, right? They ensure unidirectional blood flow. That's all. One direction blood flow. But what is it? You have to know which direction it goes. From the tricuspid, that is the one on the right side. That's the valve. It's between the right atrium and the right ventricle. Then the pulmonic is between the right ventricle and the pulmonary artery. This is the valve allowing one direction of blood flow. The mitral valve, which is bicuspid, is two-shaped, is between the left atrium and the left ventricle, while the aortic is between the left ventricle and the aorta that allow blood to go into the system. Therefore, what is the easy way to remember them? From your body to the tricuspid, to the right ventricle, pulmonic, lung, mitral, left ventricle, aortic, and the body. This is the unidirectional blood flow, the straightforward way to understand it. But this is the mnemonic. The memory trick is what? Try pulling my aorta. YT is the tricuspid, P is the pulmonic, my is the mitral, and the A is the aorta is the aortic valve. This is the direction of blood flow. And when you know that, you can't make a mistake about it. You know which one direction you're supposed to go, but it's better to look at the diagram to know what we're talking about. So this is the heart, and you can see this is the superior vena cava, inferior vena cava, right atrium, and this is the first valve going here into the tricuspid. Then it goes to the pulmonary artery to the pulmonic valve right here, and it will come back to form where you go to the mitral valve into the left ventricle. From the left ventricle, it goes through the aorta, and then it gets extended down. So this is the unidirectional blood flow of our valves and allowing blood to go in a single direction. Now, you have to know where these valves are located. There's a bunch of mnemonic, but the easy way is APET-ME, right? Or you can use any acronym you want, but this is the easy way. Then you have to look at it and see where. I've given you where they're located. Second intercostal space, third intercostal space, fourth intercostal space, fifth. But which location? Is it from the right of the sternal border or left? And so this is the diagram to show you. You have to be able to, in case they ask you to pinpoint the chest wall is like that. And this is the sternum, right, with the manubrium. This is your first rib, second rib, third, and fourth, and fifth. The first intercostal space is between the first 2 ribs. So this is the first intercostal space. The second will be between the second and the third. So this is the first location to find the aortic murmur. This is where it's going to be. On the right side of the sternal border. Your right side is the left side of the patient, and therefore patient right side will be the left of you. So this is the aortic, and then the pulmonic is the second intercostal space on the left side. So this is where the pulmonic with the herpes point here, and tricuspid is the fourth intercostal space, while the mitral valve is the fifth at the mid-clavicular line. So this is the diagrammatic representation of the location of each of the valve. So to listen to them, this is where you put your stethoscope to listen to them. That is the first thing, and that's the location to be able to be familiar with them. This is the normal valve, where to find them. Now, if I know now the normal valve, I got to know what happened to them. There's 2 main disorders with the valve, right? There's 2 things that can happen to the valve. Either they're stenotic, that means they don't allow blood to flow. So the valve opening is narrow, is almost closed, is obstructing forward blood flow. You know we are having unidirectional blood flow through the valve, and that is the direction of the heart. Therefore, Obstruction of forward flow. What will happen? Blood will back up into the chamber before the valve. Back up, okay, into the chamber before the valve. And that can lead to symptoms regarding to that area of that chamber. That is the clue. When we have regurgitation, I call it a leaking valve. It's an insufficiency. It's like a varicose vein. Blood is going to reflux back into where you pump it from. So valve does not completely closed. In the process, you have a backward flow of blood to that place, right? And therefore, there is an unequal blood flow going forward and blood flow going backward. And the symptoms may change. Think about it when it comes to that situation in the question form. Now, what do you want to do? You know you can have stenosis and you know you can have regurgitation. They're going to ask you questions on where to listen to. Is it aortic stenosis or aortic regurgitation? Think about it. I already say that you have to know those locations. The easy way to remember them, if it's stenotic, that means if you have stenosis, you should go and listen to the valve at the original location. If it's regurgitation, go back and listen to where the blood is refluxing. But another way too is go and listen. There's some situation you have to listen at the point of where you have the original valve or go back where it's refluxing. Therefore, regurgitation returns. That's the idea. Regurgitation, the mnemonic returns, but stenosis will stay. Therefore, if I have aortic, pulmonic, tricuspid, mitral valve stenosis, I'm just going back to the original location that we saw, that the aortic will be second intercostal space on the right, the pulmonic will be second intercostal space on the left, the tricuspid will be fourth intercostal space on the left, and the mitral valve fifth intercostal space involving the mid-clavicular line. I'm going there and listen to there. That is where the original valve is located. But if it's regurgitation, you have to do two things. Either go back to the original or go back to the reflux. So look out for the answer choice, whether they want you to go to the original or go back to the where it's refluxing. So there's two ways. In aortic, it doesn't stay at the original position, which is the second intercostal space on the right side. It goes to the third intercostal space on the left side. That's the herpes point because of the backward flow into diastole. Now, pulmonic, it stays, but then it can radiate to the left sternal border. If it's mitral will radiate into the axilla, into the armpit. So it's very, very unique. You can listen to it at the fifth intercostal space, but you can hear the murmur radiating to the axilla. And the tricuspid, same spot, but it can also radiate to the right sternal border. These are the concepts I want you to know. The NCLEX essential cardiac valvular disease that you need to master for your nursing school and the NCLEX. Now, what are the causes? You got to know a little bit. Rheumatic heart disease, infective endocarditis, congenital defect, or age-related calcification, or maybe connective tissue disease like Marfan disease, right? Marfan syndrome. All these conditions can cause valvular heart disease. The next thing is, what do you do in your assessment? I can tell you most of your questions will be on the left side disease. So know the left side disease problem more than the right. But if you want to learn something, always learn the left side because they are the most common. What do you think? Aortic stenosis. Aortic stenosis, I'm having problem pushing blood through the aortic valve. In the process, less blood going out. You have syncope, angina, dyspnea, which is the sad mnemonic for the symptoms of aortic stenosis. And therefore, you're going to have what? Harsh murmur, which is what? Systolic. I'm going to give you the mnemonic on how to know which valve will give you a systolic murmur and a diastolic murmur. So listen carefully. For mitral stenosis, blood is going to back up into the lung. So you have what? Dyspnea exertion, blood in your cough because your lung may have pulmonary edema. Blood in the atrium will be fibrillating and it causes diastolic murmur. For aortic regurgitation, because of the blood going back and forth, you can have wide pulse pressure and bounding pulses and diastolic murmur. Then in a mitral valve regurg, it's back and forth into the lung and the left ventricle. So you can have fatigue, palpitation, and the systolic murmur radiating to the axilla. Now, what do you know? How do you know it's a systolic or diastolic? This is your mnemonic. Mr. A.S. MVP is systole, right? He play in systole. Miss A.R. rest in diastole. That means mitral regurg, aortic stenosis, mitral valve prolapse. What do? You hear a systolic murmur. And mitral stenosis, aortic regurgitation, you're going to hear diastolic murmur. That's the mnemonic to know what kind of sound, whether it's systolic or diastolic murmur. Know this once again. Know this once again. Know this. And now, priority next intervention. Of course, you got to watch for heart failure. As the blood back off, they can have lung symptoms, right? Crackles, edema, fatigue, oxygen saturation is going to go down. Decrease access for cardiac output, especially if there is stenosis, right? Hypotension, dizziness, and syncope. That's a problem. Sometimes you got to prepare them for valvular heart replacement. Very important. And you have to educate them about anticoagulation. If they have mechanical valve, the complication associated with it, what do they do with the anticoagulation? And of course, every time they're going to have condition where there's going to be infection, prophylaxis is needed, especially dental and invasive procedure. What do you need for the NCLEX? Always, if a client has a new onset confusion, hypotension, or chest pain, pulmonary edema, you should worry that this needs priority. Confusion, hypotension, chest pain, and pulmonary edema are all bad signs of perfusion issue and a heart failure. They will not use those words, but they will give you signs and symptoms patient will complain about. And that's when you intervene. This is cardiac valve disorder, nursing essential. All the things you need to know. This one video has all the information. When they give you a question, go back to this video, watch it again, and you will know that, oh, this is the answer. Concept, mastering, mnemonic for your nursing school and NCLEX. Thank you for watching. And if you like this video, just comment on it, share with your friends, like,